Welcome everyone, and thank you for coming tonight. A lot of familiar faces here and a few new ones, so thank you everyone. And we'll get started here. Tonight's session is coping with headaches, but first we have a few housekeeping slides that we do. And we do this at the beginning of every meeting for anybody who's new here or anybody who's new watching our videos online. So introductions here, my name is Deb Angus. I'm the founder of this group. We started in November 2016. I'm a traumatic brain injury survivor warrior. I'm coming up to now 18 years post-injury, and fourth concussion. 3 I wasn't aware of, but the 4th one hit me and in 2001, and I was never the same since and couldn't figure out why. And so I did have a neuropsych assessment done, and I was diagnosed as mild borderline moderate TBI, which is permanent brain injury now. And I'm also the author of this book here, which I wrote and researched over a 10-year period. And it is available at the Calgary Public Library, and I do have copies here as well if you're interested. And my cohort is Josie, and she is a former healthcare nurse, and she is 3 years now post-injury. And she still advises me in the background and meet for coffee every now and then. She's had some family issues come up recently. So why are we here? To raise awareness about the seriousness of concussions, to help you understand the symptoms of a concussion, how easily these injuries happen, the healing process for concussions, and consequences of multiple concussions. To provide information and support for those affected by these injuries, individuals, family, friends, and co-workers are all welcome to attend here. To share coping strategies that will help you while recovering from a concussion, and to live well in spite of a brain injury. And we have a medical disclaimer here as well. The ideas, suggestions, general principles, and conclusions presented are subject to your personal health and sound medical advice. Every possibility is not represented here, nor do we presume that all possibilities relate to your specific situation. This awareness group is not a substitute for recognized medical advice or treatment. Always consult your healthcare practitioner for medical advice. And our meeting structure, generally, we try to stick to 20-minute presentation. And if we have anyone who's fairly high symptomatic, I will ask at the 20-minute point if you need a break. And if not, we will continue on with the rest of our presentation. Sometimes we bring in a guest speaker, and they talk on the related topic that we're covering that evening. And then at the end of the meeting, we follow with a 30 to 40-minute sharing circle, and that part we do not record. Group guidelines for the closed group. Thoughts, feelings, experiences shared in this group will stay in this group. Respect others' right to keep their information private. Accept and respect what is unique to each attendee in the group. Be respectful of others' spirituality, religion, and belief systems. Allow others equal time for sharing. And if you prefer to remain silent and pass on sharing at any time, please feel free to do so. And cell phones, if anyone has one that they haven't shut off yet, that'd be greatly appreciated. And we'll get started with the presentation. Coping with headaches. Okay, so our outline for this evening for our presentation. We will start with concussion and headaches, and then on to types of headaches, when you should be concerned, treating headaches and coping strategies, links and resources, community resources, Q&A, and then we finish off with open discussion and sharing circle. So we start with concussions and headaches. Headaches are the most prevalent complaint with concussions. Who here is dealing with a concussion and has headaches? Yeah, a lot of you. Headaches make it challenging to carry out daily activities and cause difficulties with thinking and remembering things. Most headaches usually clear up within minutes or days following a concussion. Sometimes headaches can persist for months. Neck issues should be investigated as a possible cause for headaches. Often structural issues or tissue damage with the neck can cause an array of symptoms, such as dizziness, fever, burning pain, headache, night sweats, blurred vision, tiredness, and facial pain. Headaches could also be a sign you're not pacing yourself correctly or are reaching your threshold for the day. Very important to incorporate brain breaks and better coping strategies into your daily living. So who here practices their brain breaks throughout the day? Good, good, good. And this is why, because size does matter. You have to learn to manage your energy when you're dealing with a concussion. So here it shows a normal average person without a brain injury has about 15 hours of energy per day. He has the larger battery pack there. But once you have concussion, your energy is reduced down to just 4 hours a day. So this has a significant impact on what you're able to get accomplished in one day. And that's why it's so important to learn to manage your energy and to take your brain breaks, as well as other things. This here also explains why this is so important. Your reserve energy gets drastically reduced once you've had a concussion. So normal brain there on the left has a huge reserve section, and it has just a small sections there for cognitive demands, emotional demands, and physical demands. But then when you have a concussion, your reserve shrinks down to almost nothing, and larger demands for cognitive, emotional, and physical demands. And so that when you push yourself too much, your brain is healing while you're also using it, and it only has so much juice to give you for the day. So if you use up too much with all your other cognitive demands and physical demands, you have no reserve energy to access to get you through the day. Your brain's just going to shut you down. There's no way of getting around this. You have to pace and manage your energy. Concussions and headaches. Sometimes headaches can be the result of not keeping your body and your brain well hydrated. It is commonly recommended to drink 8-ounce glasses of water per day, the 8x8 rule, which equals about 2 liters. Although there is no scientific evidence to support this rule, staying hydrated is important. And that is because your brain is 73% water. It only takes 2% of dehydration to affect your attention, memory, and other cognitive skills. While not related to concussion, certain medications such as nitroglycerin prescribed for heart conditions and estrogen prescribed for menopausal symptoms are notorious causes of headaches. So it's best to discuss all your medications with your healthcare provider to eliminate any other causes of headaches. Multiple concussions can have compound effects on headaches and related pain. Research indicates 2 or more concussions can lead to more frequent and severe headaches. Headaches following multiple concussions or a more serious injury gradually taper off within the first 3 to 6 months. However, I have met and talked to many people who are saying they are contending with constant head pain 24/7, no relief, as long as 12 to 18 months following a concussion or a head injury. And many report no medications whatsoever have helped. This can be very distressing, especially if you've never had headache issues prior to concussion. So many of them explain that this is like a pressure in their head, a constant pressure, and it never goes away. And I remember I had it for the first 3 weeks, and luckily it just went away on its own. But after a really bad head pain episode at the back of my skull, I thought my head was going to explode, and I didn't know what to do. And so I took the pain medication, even though I knew it wouldn't work, and then I went to sleep. And miraculously, 2 hours later, I woke up and it was gone. So I reported it to my family doctor the next day, and he said, "Oh, no. He said, if that ever happens again, get yourself to emergency," because he said, chances are you may not have woken up. But it's like a pressure in your head that just won't go away. Like I was even complaining, it felt like my head was too big and I couldn't fit my hat. My hat felt too tight. And he just kind of laughed at me, but that's how it felt. So those with a pre-injury history of headache or migraines may experience ongoing complications. And females were more likely to report headache. That's probably because of hormone-related issues. In a 2011 study in the Journal of Neurotrauma, however, only 18% of the participants reported a history of headache prior to injury. However, more than 41% reported headaches at 3, 6, and 12 months post-injury. So this becomes known as post-concussion headaches, which can develop into more serious diagnoses, such as post-traumatic headache, defined as persistent headache or migraine for at least 3 months, or post-concussion syndrome, which includes other symptoms such as dizziness and photophobia, sensitivity to light. And so now we get into the various types of headaches, and the 4 most common ones are sinus, cluster, tension, and migraine. A sinus headache is pain behind the brow bone and or the cheekbones. Cluster is pain in and around one eye. Tension is pain like a band squeezing the head. Migraine is pain, nausea, and visual changes are typical of the classic form. So I'll go into those 4 different headaches and explain a little bit more about them. Sinus headache typically occurs in the face, at the bridge of the nose, and in the cheeks and across the forehead. May be accompanied by nasal congestion and postnasal drip. It affects people of all ages, and those with allergies seem to be most vulnerable, and the frequency of these headaches varies. Generally hours in length they last, and often seasonal. Mild to moderate steady pain. So cluster headaches occur 5 times more often in men than they do women. Although anyone can get cluster headaches, the typical patient is a middle-aged man with a history of smoking. It occurs in cyclical patterns or clusters, generally lasting 6 to 12 weeks. Commonly awakens you in the middle of the night with intense pain in or around one eye or on one side of your head. Bouts of frequent attacks, known as cluster periods, can last weeks or months, usually followed by remission periods where the headaches stop. During remission, no headaches occur for months and sometimes even years. Fortunately, cluster headaches are rare and they're not life-threatening. One of the most painful types of headaches, very severe pain. Tension headache. Tight squeezing sensation, often around the entire head or on both sides. It often feels as if your head is being squeezed by a vice at your temples. Generally not accompanied by any other symptoms. Associated with decreased tolerance for stress, decreased thinking ability, and depression. Usually occurs later in the day. Pain level rated as mild to moderate. Then we get into migraine headaches. It happens because of an area of the brain becomes hypersensitive and can trigger a pain signal that spreads out to other parts of the brain, similar like ripples when you drop a pebble in the water. Dull throbbing sensation, usually on one side of the head. Usually get a warning signal that a migraine is coming on, such as seeing spots or bright lights. This is called an aura. Pain relief. Pain level is rated as moderate to severe. Symptoms vary from person to person. Disturbed vision, light sensitivity, sensitivity to smell, sensitivity to sound, nausea and vomiting. You may have different symptoms during different attacks, and attacks can differ in length, frequency, and severity. Some people only experience nausea, which is common in children. Others may only experience a migraine aura without any head pain, also referred to as an ocular or optical migraine. It includes halos, sparkles, or flashing lights, wavy lines, even temporary loss of vision, And here's a sample of some of the wavy lines, and they usually are moving and flickering. They start in a small spot and they just kind of expand and go out to the side. I didn't want to put an animation on here. I did find many of them online, but I was afraid it might trigger somebody. Migraines can last anywhere from a few hours to a few days. In more severe cases, they can last longer. Migraines post-injury appear to have a strong genetic link, as 70% of migraine victims have at least one close relative with the problem. Then there's rebound headaches. Sometimes, so we covered the four main ones, so now we're getting into some other types of headaches that aren't the four main ones. Rebound headaches, sometimes the very medicines used to treat headaches can actually cause headaches. When pain medicines are taken daily or on a regular schedule, missing 1 or 2 doses can result in a headache. You can also develop a rebound headache if you overuse your medications. Cervicogenic headaches. This type of headache can occur when there has been some injury to the muscles and soft tissues in the neck and the back of the head. Did you have a question?
No.
Okay, thanks. Many nerves that are located in the tissues and bones of the neck have branches that travel to the skull and the scalp and can result in head pain. Often starts in the neck, shoulders, and back of the head, and sometimes travel over the top of the head. Neck movement or positioning can make the pain worse. These headaches are not usually associated with nausea. Pain levels range from mild to severe. TMJ headaches. TMJ stands for temporomandibular joint. How's that? The joint between the jaw and the skull. Trauma to the jaw can result in stretching injury and inflammation to the ligaments that hold these joints together. Malocclusion or misalignment of the teeth by dislocation of the jaw can lead to further inflammation and pain in these regions, often mistaken as headache. Sometimes pain in this region can actually be from grinding your teeth at night and not TMJ at all. So that would warrant a visit to your dentist, and probably they would prescribe a mouth guard for you. Or actually I found that utilizing relaxation techniques, after a little while, you don't even need the mouth guard anymore. More serious types of headaches or head pain, trigeminal neuralgia, a chronic pain condition that affects the trigeminal nerve, which has 3 major branches that carry sensations from your face to your brain. So there's one branch that comes along here across your chin, there's another one that comes across your cheek, and there's another one that comes across your eye and over your forehead. Episodes of severe shooting or jabbing pain that may feel like an electric shock. Mild stimulation of the face from brushing teeth, putting on makeup, even the wind may trigger a jolt of excruciating pain. Other triggers can produce sudden electrifying lightning bolts of pain. Affects women more often than men and occurs most often in people over 50, but can occur at any age. It is caused from aging, tumors that are pressing against the nerve, MS, stroke, or trauma to the face, neck, or head. Severe facial pain is often referred to as the suicide disease. Most often treated with medications or surgery. Occipital neuralgia, it's a neurological condition often confused with migraines. It involves a pair of nerves at the back of the head below the skull that wrap upwards and around the back of the head. Injuries that involve whiplash movement or rotational forces may stretch and injure these nerves, causing inflammation and nerve pain, which is also referred to as neuralgia. This pain is usually sharp, stabbing, and radiates up the back of the head, or it can be dull and aching. Often there is referred pain that is felt behind one or both eyes. Then there's temporal arteritis. Inflammation of the large temporal arteries located on either side of the head, twice as common in women as in men, and usually occurs age 50 or over or older. Pain is severe, throbbing, and burning, most often at the temple on one side of the head.
Also includes low-grade fever, fatigue, loss of weight or appetite. A tender scalp or temple may also occur. Chewing can cause aching in the jaw muscles. This is an immune response where autobodies attack the blood vessel walls. Swelling can progressively narrow the affected vessels, reducing blood flow. In severe cases, arteries can become totally blocked. If this happens in the artery supplying the retina, it threatens the vision in that eye. If an artery that serves the brain is impaired, a stroke could result. When should you be concerned? You can take care of many types of headaches by yourself, and your doctor can give you medication to control most of the tougher headaches. But some headaches call for prompt medical care. Here are some warning signs for when you should worry about headaches. An unusually severe headache, where your headache becomes suddenly worse, or headaches that get steadily worse. If you have nausea and or vomiting with a headache, you have increasing sleepiness with headache. Headaches that first develop after age 50, where you've never had a prior history of headaches at all. A major change in the pattern of your headaches. Head pain that increases with coughing or movement. Changes in personality or mental function. Headaches that are accompanied by fever, stiff neck, confusion, decreased alertness or memory. Neurological symptoms such as visual disturbances, slurred speech, weakness, numbness, or seizures. Headaches that are accompanied by a painful red eye. Headaches that are accompanied by pain and tenderness near the temples. Headaches after a blow to the head. Headaches that prevent normal daily activities. Headaches that come on abruptly, especially if they wake you up. And headaches in patients with cancer or impaired immune systems. So now we get into the section about treating headaches. A healthcare provider will rely on your history and symptoms to sort out what type of headache you are having and how best to treat it. Treatment will depend on each individual case. Important to discuss your headaches with your doctor and keep track of headaches and your response to treatment. Many people use a headache diary to help them do this. Did everybody get the handouts that were available for today with our resources? And that's here if you'd like to pass them along. And there are charts in there too for the headache diary in there and all the references that we'll be talking about. So a headache diary, a daily headache diary is one of the most important tools you can do for yourself and your medical team. An accurate headache diary serves to monitor the frequency, duration, and severity of your headache over time. Identify patterns that may help determine triggers and improve treatment. That is major right there. A lot of times you can just do this on your own. You don't have to wait for a doctor or a headache specialist to tell you about this. You can do a headache diary on your own, and you'll be shocked after a few weeks. You might start noticing the pattern that you develop headaches only in a certain location or a certain time or after a certain activity. Track medication use and response to that medication. Maintain long-term records of what has worked and what has not. A diary can help your medical team plan your treatment and help you better manage your headaches. How to keep a headache diary. There are a number of options for keeping a diary. No matter which method you choose, it is important to maintain the diary as carefully as possible. There are various apps, computer-based programs, and printed diaries available. You can refer to the reference link for the Stanford Healthcare Headache Diary. The link is provided on your handouts there to access a comprehensive list and links. So if you go to their website, you'll have access to the links that you can just click on and see what these various apps and computer programs are about. Whether you use one of the above options or use what a headache clinic will provide to you or develop one of your own, it is important to maintain the diary as carefully as possible. Here's an example of the Alberta headache diary. And there are PDF files available online. I have provided those in your reference links in the handouts. But it just goes to show you a general idea of what one looks like. Most often, treatment of the chronic tension type headache consists of such medications as tricyclical antidepressants. These agents not only diminish depression but also decrease pain. The periodic worsening of headaches, if they have characteristics of migraines, are treated with typical migraine medications. Attention to psychological factors is also very important. Family, friends, and employer or teachers should be educated that headaches are not purely psychological, but are related to the disturbed structure and chemical function of the brain now because of a concussion. A psychologist may also be helpful in teaching pain coping techniques and in treating the psychological symptoms, such as anxiety. No medication methods are also advisable under coping strategies here. Avoiding your triggers is number one, so that's one of the things the headache diary will help you to identify as your triggers, such as fluorescent lights, flashing lights, digital screens, and loud or unpleasant sounds. It's very important to keep well hydrated, as we discussed earlier. You can also go to a quiet place or go outside and get some fresh air when you're experiencing a headache or feeling one coming on. Laying down and turning off the lights, such as we showed in our brain breaks there. Healthy habits should be encouraged. Regular sleep and meal time schedules really does make a difference. The injured brain, while it's healing, it just loves a routine. So it knows what's coming up and it doesn't have to try and figure out what's coming next, and that puts a lot of stress on a healing brain. Elimination of nicotine and alcohol, that seems to come up a lot. We're never going to get away from it. You're going to have to stop drinking while you're recovering from a concussion. Exercise at least every other day. Certain foods can trigger headaches. We hear about this a lot, such as, this is not a comprehensive list, but just some examples. Aged cheeses, chocolate, citrus foods, wine, caffeine, processed foods, because of all the additives in there, as well as additives like MSG and nitrates. Nitrates are usually found in processed and deli meats and bacons and all that type of stuff. And artificial sweeteners, as we discussed in some of our earlier videos, artificial sweeteners are pure brain poison to be avoided at all costs. And you can also put a cold cloth or a hot pack on your neck or your head. Practicing deep breathing really does help. Manage stress and anxiety is very important because headaches, stress and anxiety can cause headaches or make them worse. Relaxation techniques are also very helpful. These can be learned by biofeedback techniques as well as other methods such as meditation. Relaxation guided meditations are one of my favorites. There's several of them available online. Use them every day. Yoga and Tai Chi are also very helpful, as is acupuncture and therapeutic massage. Very helpful coping strategies when you're dealing with headache or any type of body pain. Essential oils can also be helpful, like peppermint, eucalyptus, lavender, and chamomile. And there's also one here called Self-Mind Clearing. This was submitted to me by one of our regular attendees here. Thank you, Patty. And this is a self-administered light touch technique, and it's used for focusing and quieting the mind, and it helps to clear stress-related headaches. There are links provided in your handouts there where you can access a PDF copy of that chart and the various exercises. And these positions are very simple to do, and you hold them for 10 minutes each, and it is very relaxing. It's very nice to do. So we're finishing off here, and I like to always have a little slide to finish off here. Never ask Google for medical advice. I have gone from mild headache to clinically dead in 3 clicks. But this is more or less to stress the importance of why I went through the different types of headaches, because it's more complicated than what we think. And it's very important if you know or understand the different type of headaches that you have. And that helps you cope better and also gives better information to your doctor as well. So now we move on to our links and resources, and these are the handouts that you have, everything from this point on. So these are some of the resources and references that I use to put this presentation together. Things like natural history of headache after traumatic brain injury, TBI fact sheets, headache after traumatic brain injury, headaches after head injuries, post-traumatic headaches, post-concussion headaches, neck pain and headache. Could your neck pain cause a headache? What type of headache do you have? Cluster headache, trigeminal neuralgia, Migraine Pal looks like a very good site to access for extra help online. When a concussion is not a concussion, he basically talks about dehydration there. 15 benefits of drinking water, 7 science-based health benefits of drinking enough water. What's that constant headache, pain in the temples? And that talks about that temporal arteritis. And headache, when to worry and what to do. Stanford Healthcare Headache Diary, so that's the link where you go to get copies of the links that they suggested of all the different apps and computer programs for different samples of headache diaries. And then there's the Alberta Health Headache Diary, and they also have an instruction sheet. All those were provided in your handouts there. I've given you copies of those. The Canadian Headache Society, Migraine Canada, is also a very good resource online. And Concussion, Your Guide to Recovery, Sunnybrook Health Services Centre, that's in Toronto, and they had some information there on headaches. Essential oil for headaches, you can refer to that. Now you just Google and look in different books about essential oils, and you can find out a lot of information there. I know you're very up on the essential oils there, Gayleen, so you probably helped Dean a lot with that. Society of Healing Touch Program Alberta and Self Mind Clearing and Penny Burdock. That's the link where you can get the PDF copy, or you can just Google Self Mind Clearing and Penny Burdock and you'll find the resources there. So for further reading, Diane Robert Stoller, Coping with Concussion and Mild Traumatic Brain Injury. She has a chapter in there on headaches. Susie Cohen, Headache Free, Relieve Migraine, Tension, Cluster, Menstrual, and Lyme Headache. So she covers pretty well everything. I believe she was a pharmacist, that one. Carolyn Bernstein, The Migraine Brain, Your Breakthrough Guide to Fewer Headaches and Better Health. And Tara Spencer, The Migraine Relief Diet, Meal Plan and Cookbook for Migraine Headache Reduction. And for other information as well, too, another member from our group here passed this along to me. Thank you, Linda. And there was information about the Migraine World Summit that is happening this year. And they reported at a recent study discovered that 1 out of 20 chronic migraine patients were accurately diagnosed and given, inaccurately I think it should be, minimally effective guideline recommended treatment by the doctor. That means 19 out of 20 were potentially given the wrong treatment or misdiagnosed. So this is why it's very important that we educate ourselves and empower ourselves and learn as much as we can about headaches so that we understand what our doctors are telling us and what they're prescribing to us and that type of stuff. So this is a virtual event you can watch online, and you can register via email or join their newsletter, and their link there is migraineworldsummit.com. So then we get into community resources, and this is for headaches. There's the Calgary Headache Assessment and Management Program, CHAMP. It offers workshops, lectures, and education. It teaches skills to manage headaches and provides medication and treatment options, and they're located at the South Health Campus, and they have a phone number and a website there that you can access. This is all in your handouts. There's also the Integrated Headache Clinic. This is a pediatric headache clinic that focuses on self-management, provides assessment, treatment, and education for headaches. This clinic incorporates medical management with psychosocial intervention to maximize daily functioning and school attendance while providing pain reduction strategies, and that's the Alberta Children's Hospital, and they have a phone number and a website there as well too. And then local services for concussions for anyone that's new here or just new watching our videos. Here in Calgary we have the Community Accessible Rehab Program, or CAR. And they have 3 centers here in Calgary where it's offered. You do need a referral from your family doctor to get in there, and preferably after 3 months post-injury, but before 18 months injury. And there you have access to occupational therapists, physiatrists, social workers, psychologists, recreational therapists, speech language pathologists, and therapy assistants. And you do need a referral from your family doctor, and there is a waiting list to get into that program. As well, too, the Alberta government has now an early concussion education module for patients, and you can access it there online. And Grassroots support for concussion. There's our group here, Calgary Concussion Awareness and Support. We started in November 2016. And the other two is Concussion Life, and they started in the spring of 2017. They have a website there. And Concussion Info and Support Meetup, that's a meetup group. They meet downtown at the Calgary Co-op, and they have a link there on the meetup website. And here at our meetings, you'll have access to information handouts, and as well, I try to provide you with the resources handouts there as well too. You can take those home with you. And also available on Facebook and YouTube are our presentation videos. And I do highly recommend anybody new here or just new watching online, they should watch the first two presentations that we did. What is a concussion? The introductory presentation, and consequences of multiple concussions, so you have a basic understanding of what a concussion really is. As well as we have coping strategy videos there as well too, parts 1, 2, and 3 could be very helpful as well. So our upcoming meetings, we meet the last Friday of every month from September to May. So our last meeting of the season will be Friday, May the 31st. And our topic will be Survivor Warriors Success Stories. I'm putting together a panel of people who have dealt with concussions and how they're getting along now and back to work and that type of thing. So I have one confirmed speaker, a panel member, and 2 maybes. So I'm still working on that, and hopefully we'll get that together. And then we have a list of upcoming topics and guest speakers that a lot of our members have suggested. So there's no set schedule on there, and it just depends on who we can get in here and when their schedule allows and that type of thing. So we do have flyers here for our next meeting. You can pick those up and take those with you. Or if you prefer to receive a flyer electronically, you can add your name to our email list. And if you'd also like to visit our Facebook page, and you can keep up to date on our meetings, pertinent articles, events, and general information. So that is the end of our presentation for this evening. Does anyone have questions or comments? We're doing good? Okay, then we will get into our open discussion and sharing circle. So I do ask people to allow equal time for sharing, and general questions to start off with would be state your first name, how were you injured, what diagnosis have you received, and what do you wish to share this evening. And we do not record this part, so I will be shutting the camera off now. Thank you.